Good evening from Appletoe Farms. Well, I am here with the girls this evening, and we're going to talk about the importance of deworming and staying on top of it with your goats. It is better to deworm early rather than late. And I'm going to share with you some of the thoughts on this. And this information largely comes from Dr. Kaplan, the parasite expert, and Tim at Lanessa Farms, who has many excellent videos on this subject. So the very best test that you can do to see how your goats are doing is the FAMANCHA. Check the eyelid for anemia. If you've got very little pink or white, seriously, you need to get them dewormed. Now, let's talk about a situation where perhaps they're skinny and perhaps just not themselves. Their coat, it doesn't look good. You can't get any weight on them. Well, that is often a sign of a type of roundworm that is absolutely the most deadly, and that is barber pole. So first thing to do is check the eyelids, because barber pole makes your goats anemic just as other roundworms do, but very bad so, and they can die from anemia. So we're going to check the eyelid for anemia. One note about the thought of, well, I want to go natural. I want to treat them naturally. And so one of the thoughts is I'll give them garlic. That'll deworm them. Or pumpkin seeds. That'll deworm them. And the fact is, folks, it's not going to do what you need it to do. For one thing, garlic thins the blood. And when you have goats with anemia, you do not want to thin the blood. Very serious. But what are things that you can do? So you've determined that your goat needs dewormer. So B-complex shot, iron shot, if they're very anemic. These are things that will help resolve the anemia. But it will take 4 to 8 weeks for that FAMANCHA to look pink again. And so, again, act fast. Don't wait to see if they're going to get down and be ailing from this visibly. So what's going to happen after you do figure out, okay, it's worms, I've given the dewormer? Well, if they have a really heavy worm load, we need to understand that what is actually happening. So they have done tests where a goat died and they opened it up, turned the gut, the intestine inside out, and there you will see worms hooked on, lined up, side by side by side, all along that intestine. So now you're going to give that goat of yours a dewormer. It's going to kill those. Well, what you're going to have in very heavy worm load cases are what's called micro holes in the gut, from where the worms were sucking on the gut, sucking blood. That's how all the worms live. And now those are gone. So you've got these micro holes. And from there, you get infection that can very much turn deadly. And so the recommendation is, in serious cases where you see anemia and you feel like, okay, there is good reason to believe that there is a heavy worm load, you need to act immediately. You give them the appropriate dewormer for what is wrong with them. In the case of barber pole, they may not have diarrhea. They may not have much for outward symptoms other than they just can't gain weight. They're skinny. Well, they need to have a dewormer that's strong, effective. You need to be very accurate with it, and it's called Prohibit. That is the one that all the people I know of that have had Barber Pole have saved their goats with. Prohibit. And then they need their vitamin B shot. Lots of water. If they have a heavy worm load, put them in an area where they don't have to compete for their feed. They need rest. They need calm. They need lots of fresh water. And give them the antibiotics right away. Give the dewormer, give the antibiotics, give the bee shot. And then, of course, we're always going to be checking temperatures. We're going to start with that before we do anything serious with them. Okay, what about their diet during this period? Now, you might think, well, this is the time to really ramp up their groceries. Well, the fact is that you want to keep their diet bland. That means no alfalfa and just the regular plain pellets and grass hay and lots of water. We don't want the kind of pH that alfalfa hay, alfalfa pellets are going to give them. That's not going to help them heal. So again, let's just go over this quickly. Whitish looking eyelids, gums, very serious, very heavy worm load. Immediately act, get the proper dosage, the proper dewormer. Don't give improper dewormer amounts. If you don't give them enough, all you're causing is resistance, and you're not going to be able to take care of the worm load. You give them too much, and they can die from the shock. So be careful. Get Dr. Kaplan's chart. Follow it. Get your scale. Weigh them. Know what they weigh, and give them the medications appropriately. We have covered the dewormer, the vitamin B complex shot, lots of fresh water, and antibiotics to ward off any infections. So why give antibiotics right off when you're deworming a goat with serious worm load? Well, what can happen quickly is your goat can develop, as I said, the micro holes in the gut, develop infection, and then you're going to find a lower than normal temperature, which indicates sepsis and then death. So we want to, again, act quickly, really watch every single member of your herd and act appropriately. Now, we're not talking about a broad, a deworming every goat every month for no reason at all. Be specific, watch each one, know your goats, know what they should look like when they're healthy, and then go from there. Well, I hope that this has helped you folks, because parasites are the number one enemy of goats. And so we have to keep learning. I mean, I've never had Barber Pole in my herd, but many people do, and it is the number one cause of death in adult goats. So let's stay up with the information and take notes, whatever you need to remember exactly what the treatment is to keep them healthy and get them recovering from a heavy worm load. Well, folks, thank you so much for listening. I hope that something in this information is helpful to you. Take care. Happy homesteading.